Welcome to the deep dive. This is your shortcut to getting really informed, even on stuff you might not usually dive into. Today, we're tackling something that, well, it really affects our food supply and animal welfare, but it often just flies under the radar. We're talking about cattle liver abscesses. It sounds specific, I know, but it's actually a really common condition, often hidden, especially in feedlot cattle. And it has some pretty big economic and welfare consequences. So we've gathered a bunch of sources, research papers, reviews, the works, and our mission, as always, is to pull out the key insights for you. Think of it as your fast track to understanding liver abscesses in cattle, from, how they start to how we try and stop them.
Yeah, and what's really interesting here is how this condition kind of highlights the delicate balance in an animal's gut.
Yeah.
And when that balance gets thrown off, well, seemingly small things can lead to pretty major health issues and economic problems, too. It's quite a complex picture.
Okay, let's dig in then. When we say liver abscesses in cattle, what exactly are we talking about, like in simple terms?
Right, so imagine the liver, and inside it, you get these sort of walled-off pockets. They're filled with pus, basically sites of infection. Bacteria cause inflammation, tissue damage, and it all gets contained usually inside the liver. Could be one, could be several.
Got it, like little infection bubbles inside the liver. So how common are these, especially in, say, beef or dairy cattle?
They're a global issue, especially common in feedlot cattle and dairy cows, mostly because of, well, what they eat. In the U.S., if you look at slaughtered beef cattle, the rates can bounce around a bit, but typically you're looking at maybe 10% to 20%. Interestingly, it seems higher in Holstein's dairy cows, maybe around 28%, give or take. Lower in beef heifers and steers, more like 13% to 16%.
Wow, okay, so potentially 1 in 5 beef animals, maybe even close to 1 in 3 Holsteins. That feels significant, especially when you think about the money side of things. I'm guessing it's way more complicated than just, checking out a bad liver.
Oh, absolutely, way more. Yes, the condemned liver itself is a big loss. It actually accounts for something like 58% of all liver condemnations in the U.S., which is huge. But the real economic hit is often more hidden. The thing for you to really grasp is that these aren't just minor flaws. They silently chip away at profitability. Even when the animal looks fine on the outside, we see things like a measurable drop in how much they eat, about 1% less dry matter intake, and they're less efficient at converting feed to muscle, maybe almost a 2% drop in feed efficiency.
So they eat less and get less out of what they do eat.
Exactly. And in bad cases, their daily weight gain can drop by, say, 5% to even 15%. Even smaller abscesses, the less severe ones, still impact the final product. You get a lighter carcass, maybe 3.4 kilograms less on average, and a smaller ribeye area, too. Plus, if the abscess sticks to other organs, that means more trimming during processing, which costs money and reduces the value.
Yeah.
So it ripples right through the system.
That really paints a picture. It's not just one bad organ, it's a drag on the whole process.
Okay, so we know what they are, why they matter. How do they actually start? What's the main trigger?
The main culprit, the bacterium we point to most often, is called Fusobacterium necrophorum. Now, interestingly, this bug is actually a normal resident in the cow's rumen. That's the big first stomach compartment. It usually just hangs out. But it has these tools, these virulence factors, that let it cause damage and sort of hide from the immune system if the conditions change.
Ah, so it's an opportunist. And I've definitely heard diet is the key to those changing conditions. How does that work? What's the connection?
Yeah, the traditional explanation, the one we've understood for a while, really centers on feedlot diets. High in grains, low in fiber, or roughage. When cattle eat a lot of that stuff quickly, the fermentation in the rumen goes into overdrive, produces way too much lactic acid. And that acid overload makes the rumen environment really acidic, drops the pH way down. We call that ruminal acidosis, or sometimes just grain overload, right? Like a serious indigestion for the cow. That acidic environment must cause problems.
It does. It starts to damage the lining of the rumen wall. Creates little sores or erosions. That's called ruminitis. And those damaged spots, they're like open doors. F. necrophorum, and sometimes other bacteria too, can slip through, get into the bloodstream. Specifically, they get into the portal vein, which leads straight from the gut to the liver.
Ah, okay. Direct route.
Exactly. They travel to the liver, settle in, and start forming those abscesses we talked about.
That makes a lot of sense. Diet leads to acid. Acid damages the wall. Bacteria escape to the liver. Simple chain reaction. But earlier you mentioned surprising new insights. So is that traditional story changing? Is it not always that straightforward?
It seems like it might be more complex, yeah. Some of the newer research is, well, challenging that direct line. We're finding evidence that suggests liver abscesses can sometimes happen even without clear signs of ruminal acidosis, or even on diets that aren't super high in starch. Yeah. It points towards maybe a more complicated picture, perhaps involving other parts of the digestive tract, like the hindgut. So the key takeaway is shifting a bit.
Yeah.
Just focusing on preventing acidosis might not be the whole answer anymore. We might need a broader view. And another thing we understand better now is that it's often not just F. necroform alone. These abscesses are frequently polymicrobial.
Meaning multiple types of bacteria are involved.
Exactly. You often find others like Trupperella pyogenes, different kinds of Streptococcus, Staphylococcus. And there's an emerging one to watch, especially in Asia, called Klebsiella pneumonia. Some strains of that are hypervirulent, really aggressive, and can cause severe complications that spread way beyond the liver.
Okay, severe complications sounds
Yeah.
bad. How bad can this get if an abscess, say, ruptures or spreads? What kind of serious outcomes are we looking at?
It can get incredibly serious, life-threatening even. An abscess might rupture into the main abdominal cavity, causing peritonitis, that's a massive infection.
Yeah.
Or it could burst into a blood vessel within the liver, leading to sudden fatal bleeding. And then there's a really critical complication called caudal vena cava syndrome. That's when an abscess near the big vein returning blood to the heart, the caudal vena cava ruptures into it or causes severe inflammation around it. This can lead to dangerous blood clots forming. If those break off, they travel, usually to the lungs.
Oh, no.
Yeah, causing things like severe pneumonia, multiple lung abscesses, sometimes even aneurysms in the lung arteries that can burst. That leads to coughing up blood, nosebleeds, often fatal. It's a terrible cascade.
That sounds absolutely devastating, from a localized liver issue to something systemic like that.
Exactly. You can also see issues like portal hypertension, high blood pressure in the liver's blood supply, leading to an enlarged liver, fluid buildup in the abdomen, chronic diarrhea. And like I mentioned with that aggressive Klebsiella, sometimes the infection just spreads far and wide eyes, brain, even severe skin infections. Sometimes the eye problems show up before we even realize there's a liver issue.
Man. Okay, so it's not just bacteria, right? You mentioned other factors.
Right. It's not always just the acidosis route. Parasites, like liver flukes, Fasciola hepatica, can predispose the liver to infection. Other nutritional things matter too. Feed texture, maybe sand getting ingested and causing irritation, and just general management stuff, stress, other illnesses like stomach ulcers. They can all play a part in making an animal more susceptible.
Okay, this paints a much more complicated picture.
Mm.
So, given that they're often hidden, subclinical, and the potential outcomes are so severe, how do you even diagnose these in a living animal? It sounds really tough.
It is. It's a real diagnostic challenge. Most of the time, like you said, they're subclinical, no obvious signs, so they often only get picked up after slaughter, just by visual inspection. That's the most common way they're found.
But sometimes there are signs. What might you see if an animal is showing symptoms?
If you do see signs, they can be pretty subtle, especially early on. Maybe a fever that comes and goes, the animal's off its feed, losing weight. Sometimes they look like they're in pain, arched back, don't want to move much. In dairy cows, you might see milk production dip unexpectedly, teeth grinding, maybe tenderness if you press on their upper right side.
And if it gets more severe?
Then you see more dramatic signs. Really fast heart rate, maybe pale gums from anemia, rapid shallow breathing, weakness, sometimes collapse. An enlarged, painful liver if you can feel it. Jaundice, the yellowing, that's usually a very late bad sign.
What about lab tests? Can you run blood work? Does that help?
Blood work can give you hints, definitely. You'll often see signs pointing to bacterial infection and inflammation, high white blood cell count, maybe high fibrinogen levels, anemia if there's been bleeding, and liver enzymes, things like AST, ALP, GGT might be elevated, suggesting liver damage or blockage. But, and this is a big but, these tests aren't always specific or consistent. You really have to look at the whole picture, the clinical signs plus the lab results. It's rarely a single test saying, yep, liver abscess.
So, still kind of detective work. Can we use imaging, like actually look inside to see them? What are the options there?
Yes, imaging is where we've made some real progress for live animal diagnosis. Ultrasound is pretty valuable. It's non-invasive. You can bring the machine right to the animal. It can definitely spot abscesses. It has limits, though sometimes abscesses deep inside or on the left side are hard to see with ultrasound.
Okay, so ultrasound is a good starting point. Anything more advanced?
CT scans, computed tomography, are much more powerful. They give a really detailed view. CT can pick up liver abscesses and other infections in the abdomen with pretty high accuracy, over 90%, especially if you use it alongside ultrasound. There are even more specialized techniques, things like MRCP or ERCP, but those are usually kept for really complicated cases, maybe if you suspect the bile ducts are involved.
So we have tools, but it sounds like even with imaging, diagnosing definitively in a live animal is still a major hurdle.
It absolutely is. That's why, unfortunately, the final definitive confirmation often still comes after death postmortem examination,
Hmm.
looking directly at the liver and maybe analyzing tissue samples under a microscope.
Right, which makes prevention even more critical if diagnosis is that tricky. So how do we prevent this? What are the main strategies?
Prevention really has to be a multi-pronged approach. You can't just do one thing. It's a combination of really careful nutritional management, sometimes using feed additives strategically, and just solid overall herd health practices.
Let's break that down. Nutritional management, you mentioned that being key for acidosis. What does that involve?
It's probably the number one strategy. It's all about minimizing that risk of ruminal acidosis. That means careful feeding plans, getting the diet composition right, the balance of grain and roughage, managing the feed bunks so cattle eat consistently.
Yeah.
Sometimes using buffers, like sodium bicarbonate mixed in the feed. Key things are like slowly adapting cattle when you switch them to higher energy diets, not making sudden changes, maybe feeding smaller meals more often. And remembering what we said about new insights, maybe the focus needs to be not just acidosis, but overall gut health, potentially including the hindgut too.
Okay, diet management is huge. What about those feed additives you mentioned? What's used there?
Well, antibiotics have been a common tool. Tylosin is one that's widely used in feedlots, specifically to target Fusobacterium necrophorum and reduce abscesses. Sometimes they use what's called metaphylaxis, basically treating all the cattle when they arrive at the feedlot as a preventative measure against various diseases, including potentially reducing abscess risk indirectly. There are also ionophores, like monensin and lacillocid. They're not traditional antibiotics, but they alter the rumen environment, help cattle get more energy from feed, and suppress certain microbes.
Right, Tylosin. But with all the concern about antibiotic resistance now, is that still the main approach? Are people looking for other options?
That is a massive point of discussion and research right now. Yes, Tylosin works, but the pressure to reduce antibiotic use due to resistance concerns is immense. So there's a really strong push towards finding and validating non-antibiotic alternatives. This is a key emerging area. We're seeing more research into things like probiotics, beneficial bacteria, or specific fatty acid supplements. There was one study, for example, that showed about a 25% drop in abscesses using alternatives like these.
A 25% reduction without antibiotics. That sounds promising.
It is. It really signals a potential future shift in how we approach prevention, moving towards more sustainable methods, maybe.
Makes sense. So beyond diet and additives, what about just general farm management? What practices help?
Good overall herd health is fundamental. Catching and treating any other infections quickly because sick animals are more vulnerable. Strong biosecurity is important too, minimizing exposure to harmful bacteria from the environment or other animals. And here's something else that's gaining traction. More of a long-term strategy, genetic selection.
Selecting animals that are naturally more resistant?
Kind of, yeah.
Yeah.
We're learning that susceptibility to some of these production diseases seems to have a genetic component. It can be inherited. So the idea is maybe we can identify and select breeding animals or specific genetic lines that just naturally have a lower risk of developing things like liver abscesses. That could really lower the baseline prevalence over generations.
That's fascinating, a long-term solution.
Exactly. And then there are the more basic but still crucial things. Making sure calves get enough colostrum right after birth for immunity, keeping calving areas clean, proper navel disinfection, good vaccination programs. It all adds up to healthier, more resilient animals overall. And the payoff for successful prevention is clear. Cattle are more efficient, they gain weight better, fewer livers are condemned, carcass quality improves. It helps the animals, and it helps the economics.
Okay, so wrapping this up then. We've covered a lot of ground, from the bacteria to the economics to genetics. What's the big picture message for someone listening?
I think the big picture is that this seemingly specific issue, liver abscesses, is actually a window into something much larger. It shows the complexity of the animal's digestive system, how easily it can be disrupted, and how interconnected health and economics are in food production. We've seen how the science is evolving too, moving from a simpler acidosis story to a more multifactorial understanding. And the prevention strategies are evolving right alongside that, especially with the push away from antibiotics.
It really does show how something that sounds straightforward, like a liver abscess, becomes incredibly complex when you start peeling back the layers. New research constantly makes us rethink what we thought we know. It leaves you wondering, doesn't it? What other problems that seem simple on the surface might actually hold a similarly complex and maybe even surprising story if we just look closer?